Athena eLearning presents the Affordable Care Act of 2010. On March 23, 2010, President Barack Obama signed into law the Patient Protection and Affordable Care Act, setting in motion the broadest redesign of healthcare legislation in American history. After nearly a century of attempts by presidents to deliver a cohesive package of reforms to slow the growth of escalating healthcare costs and provide coverage for all Americans, Congress and the President finally delivered a unified package of reform measures, tax credits, and changes to federal laws regarding insurance industry regulation intended to curb the cost of health coverage, expand coverage to tens of millions currently uninsured, and improve the quality of health care for all Americans. To begin, let's first examine the major reasons for the necessity of health care reform at this time. Much controversy has arisen from people thinking that reform isn't really necessary, or that the reasons are inflated and a much less expansive program would suffice. The cost of health care in America has grown from 5.2% of gross domestic product in 1960 to 17.9% in June 2011, more than triple the percentage of 1960. By 2019, the percentage is expected to reach nearly 20%, unless steps are taken. In 2010, healthcare cost Americans $2.6 trillion, more than $8,000 for every person in America. In fact, 1 out of every $6 produced in America in 2010 came from healthcare. And it is worth mentioning that between 2008 and 2009, the gross domestic product shrank overall, while healthcare continued to grow by 5.7%. What's more, the United States spends over 30% more of its gross domestic product on healthcare alone than the next highest developed country. Public funding accounted for 47% of healthcare spending in America in 2008, and that figure was expected to reach 50.4% by 2011. Healthcare clearly is costing all Americans more money every year, and without reform, it isn't going to shrink. In the years from 1999 to 2010, employer-sponsored insurance premiums have more than doubled. Yet during the first decade of the 21st century, the median income actually fell by 7%. If unchecked, health insurance premiums are expected to double again by 2020. Americans with insurance also pay a hidden tax of over $1,000 per family per year to cover the uninsured for uncompensated medical care. And it's not just families feeling the pinch. Currently, small businesses face not only premiums that are 18% higher than large businesses pay, but also face higher administrative costs to set up and maintain a health plan. The premiums small businesses pay have 3 to 4 times as much administrative costs built into them as plans in the large group market. To illustrate this, in 2010, a 77-life group grandfathered at small group rates in California would have paid $59,000 per month in premium, but quoted at mid-size rates, the same group, same industry, same employees pay just $43,000, a 27% decrease and an annual savings of $192,000. As a result of higher costs of insurance, many small businesses aren't able to afford insurance, which in turn limits their ability to attract and retain good employees. This leads to more small businesses failing and more bankruptcies. Additionally, not having access to quality health care, including preventative care, means more lost time for small businesses as opposed to larger ones. And since small businesses in America employ over half of America's private sector workforce, health care reform for small business owners is a necessity. This creates a job lock, wherein talented American workers and thinkers remain in unsatisfying or unchallenging jobs simply to maintain their health coverage. Reforms to insurance, providing more affordable care to all, would stimulate the ingenuity of Americans, allowing more entrepreneurs to start their own businesses, improving the economy with fresh ideas, and start the Microsofts, Googles, and eBays of tomorrow. The immediate focus of the Patient Protection and Affordable Care Act is to expand coverage to more Americans and reduce instances of rescission, the canceling of insurance policies when the insured actually submits claims for benefit payment. And started in 2010, the Patient Protection and Affordable Care Act allows small businesses to claim a tax credit of up to 35% for the employer contribution to employee health insurance. In California alone, this means coverage for 392,000 small businesses that are currently unable to or struggling to provide quality health care for their workers. For children, pre-existing conditions will no longer exist. Effective 6 months after the President signed the Patient Protection and Affordable Care Act, carriers were no longer able to deny coverage to children for pre-existing conditions. For those without insurance due to pre-existing conditions, the Affordable Care Act created a high-risk pool for such uninsured starting in 2010. These pools, and allowing children to stay on parents' group coverage until age 26, are already saving American lives. In addition to reining in costs, the Patient Protection and Affordable Care Act will focus on improving efficiency in the medical field by offering incentives to standardize enrollment in other forms, promote data sharing between providers, bundling treatments to prevent fee-for-service from running up costs due to improper treatment of health issues, which can reward retreatment of health problems, and investment in more doctors and nurses to improve the pool of primary care providers. Indeed, inefficiencies in the current system are so costly that up to 30% of healthcare costs, or 5% of GDP, could be saved without compromising health outcomes. This amounts to the entire projected 10-year cost of the Affordable Care Act saved in under 2 years. Again, just improving efficiency in healthcare could save enough to pay for the Affordable Care Act in under 2 years. Typically, hospitals and physicians face a wide variance in reporting requirements across the set of carriers with whom they contract. One potential way to increase efficiency is to encourage the development of a set of performance measures that all providers would adopt and report. Standardizing enrollment forms, both individual and group, would facilitate faster enrollment, less work for all involved, especially healthcare providers who often deal with multiple carriers. By standardizing enrollment forms, applications for insurance from businesses and enrollment by employees will take place faster and easier with less chance of incorrect data entry. Databases will require less maintenance and updating. Hospitals, clinics, and doctors will get the information they need to treat patients faster, resulting in less downtime for employees and their families. The focus of the Patient Protection and Affordable Care Act is on improving quality in every facet of insuring and providing health care in America. One game changer of the legislation is to shift America's focus from fee-for-service to quality of care. Instead of a provider making money for the more procedures they perform on a patient, the incentive is to cure the condition the first time with the least amount of treatment necessary. This will also require rethinking defensive medicine, whereby procedures are run simply to forestall potential legal entanglements. According to Wikipedia, an early experience with bundled payments occurred between 1987 and 1989, involving an orthopedic surgeon, a hospital, and a health maintenance organization in Michigan. The HMO referred patients to the surgeon for possible surgery. The surgeon would evaluate each patient for free. The surgeon and hospital received a predetermined fee for any surgery performed, but they also provided a 2-year warranty promising to cover any post-surgery expenses instead of the HMO. Under this arrangement, all parties benefited financially. The HMO paid $193,000 instead of the $318,000 expected. The hospital received $96,500 instead of the $84,892 expected, and the surgeon and his associates received $96,500 instead of the $51,877 expected. Cost containment carries equal weight to expansion of coverage and increased quality of benefits. As 47% of national health care is currently paid by the government, any reduction in cost growth as a percentage of the GDP frees up funding for other public needs or reduces the deficit. According to the Council of Economic Advisors to the President, slowing the annual growth rate of health care costs by 1.5% would increase the GDP over a no-reform baseline by 2% by 2020 and nearly 8% by 2030. Expanding health care insurance coverage to the uninsured would increase net economic well-being by roughly $100 billion a year. For a typical family of 4, this implies that income in 2020 would be approximately $2,600 higher than it would be without reform, and that in 2030 it would be almost $10,000 higher. Reform would likely increase labor supply, remove unnecessary barriers to job mobility, and help level the playing field between large and small businesses. Improving America's health will increase the labor supply, lower worker sick days. Currently, the American labor force loses $1 trillion annually due to medical reasons, and thus increase the GDP. A study by the National Academy of Sciences Institute of Medicine suggests that the reduction in mortality alone would have a value of $65 billion per year. Additionally, the health improvements resulting from expansions in insurance would have an economic value of approximately $180 billion per year. By combining just two tracks, improved efficiency and increased health care to lower lost worker production due to sick days, America can improve the economy by roughly $2 trillion per year by 2030. As important as reining in costs and expanding coverage, increase in quality of benefits is equally important in the Affordable Care Act. Beginning with Medicare, Americans now have more benefits available. Medicare will pay for an annual checkup, and deductibles and co-payments for many preventative services were eliminated in 2010. A $250 rebate for Medicare recipients who have hit the donut hole for prescription payments, also in 2010. States cannot cut people from Medicaid until the exchanges start operating in 2014 unless a state faces a budget shortfall. Many preventative services would be offered without cost. States cannot cut children from Medicaid or the Children's Health Insurance Program until 2019. If you are refused coverage because of your health, you can get insurance from a new high-risk pool. The pools were established in 2010 and will operate until 2014 when insurance companies can no longer refuse applicants with pre-existing health problems. Annual out-of-pocket medical costs will be capped at $59.50 for individuals and $11,900 for families. This for any adult American who has been refused coverage due to a pre-existing condition. And the AFA tightly restricts new plans' use of annual limits to ensure access to needed care. These tight restrictions will be defined by the Health and Human Services. Effective 6 months after enactment, beginning in 2014, the use of any annual limits would be prohibited for all plans. This is for everyone currently insured. The AFA requires new private plans to cover preventative services with no co-payments and with preventative service being exempt from deductibles. This went into effect 6 months after enactment. Beginning in 2018, this requirement applies to all plans. This is for everyone currently insured. The AFA ensures consumers in new plans have access to an effective internal and external appeals process to appeal decisions by their health insurance plan. And the AFA requires plans in the individual and small group market to spend 80% of premium dollars on medical services, and plans in the large group market to spend 85%. Insurers that do not meet these thresholds must provide rebates to policyholders. The AFA increases funding for community health centers to allow for nearly a doubling of the number of patients seen by the centers over the next 5 years. The AFA provides new investment in training programs to increase the number of primary care doctors, nurses, and public health professionals. Now here are some plain language benefits. If you like the insurance you have, keep it. Nothing in the Affordable Care Act forces anyone to change the insurance they have. Period. You will have the same coverage choices as members of Congress. Every member of Congress will be required to purchase their insurance from the new health insurance exchanges when they come online in 2014. As far-reaching as the Patient Protection and Affordable Care Act seems, the American Reinvestment and Recovery Act, signed by President Obama in 2009, had already begun laying the groundwork for improvement in health care in America. Among the programs already begun are the Children's Health Insurance Reauthorization Act, which provides quality health care to 11 million American kids, including 4 million who were previously uninsured. The Recovery Act also invested $19 billion in computerized medical records that will help to reduce costs and improve quality while ensuring patients' privacy. This is one of the most beneficial changes to healthcare. By converting patient records to electronic format, accessible via hospital networks, the internet, and mobile devices, Doctors, clinicians, pharmacists, and even EMTs can treat patients with greater speed and confidence than ever before, and with higher rates of success and fewer complications due to lack of knowledge of the patient's medical history. The Recovery Act also provides $1 billion for prevention and wellness to improve America's health and to help reduce healthcare costs, and $1.1 billion for research to give doctors tools to make the best treatment decisions for their patients by providing objective information on the relative benefits of treatments. This, along with bundled care as opposed to fee-for-service, and electronic health records, combine to improve health care by changing the approach to health currently followed in America by focusing on wellness first and improving the speed and quality of diagnoses. And $500 million is budgeted to help train the next generation of doctors and nurses. This is greatly needed as the Association of American Medical Colleges estimates the nation would have a shortage of approximately 21,000 primary care physicians in 2015 without action. Let's look at the costs of the Affordable Care Act in this, its third year. The Affordable Care Act was originally estimated to cost $940 billion over 10 years. And while this figure seems daunting in and of itself, let's look at how the Affordable Care Act will change the cost of health care and improve the gross domestic product, or GDP, of America. Let's look at the cost of the Affordable Care Act on a per-American basis. At $940 billion paid out over 10 years, with more than 313 million Americans, each American will spend about 82 cents per day to improve our health care system. And don't forget what the average American family overpays in premiums to cover those who do not have health insurance. About $1,017 per year on the average, or about $2.79 per day. Now we'll look at some major figures. As noted before, just eliminating waste in the current healthcare system would save 30% of total costs, which at $2.6 trillion spent in 2010 means a $780 billion savings. Nearly the entire 10-year projected cost of the Affordable Care Act saved in 1 year, just eliminating waste. And chronic diseases such as cancer, heart disease, diabetes, and stroke impact the gross domestic product of the U.S. by an estimated $1 trillion annually. Reducing this by even 10% returns $100 billion to the GDP. And the Affordable Care Act benefits the American economy in other ways. By offering a tax credit to small businesses, more American workers will have access to quality medical care. As of November 2011, 309,000 small businesses in America have saved over $435 million due to this tax credit alone. This means more and better health care for more American small businesses, more productivity, less downtime, and healthier, happier employees. And there are more than 5 million small businesses that may qualify for this tax credit. A lesser-known aspect of the Affordable Care Act is providing needed health care to children in schools, predominantly low-income and rural children. The Department of Health and Human Services recently awarded 278 grants totaling $95 million for capital expenditures to help school-based health centers expand facilities, buy new equipment, modernize mobile clinics, and better serve rural children who cannot always obtain needed preventative and acute care. And the Affordable Care Act success stories are already rolling in. Lives saved, careers salvaged, homes kept by people who are on the verge of losing their job, their health, and their home. Now we'll look at mandated coverage, a hotly contested facet of the Affordable Care Act. Many news items and political pundits have made wild claims over what will happen for failure to comply and purchase insurance. Is the individual mandate draconian? No. Let's look at the exemptions. You do not have to purchase insurance for yourself if any of these apply. You are part of a religion opposed to acceptance of benefits from a health insurance policy. You are an undocumented immigrant. You are incarcerated. You are a member of an Indian tribe. Your family income is below the threshold requiring you to file a tax return. or you have to pay more than 8% of your income for health insurance. You are also exempt if you are covered under any of these insurance providers: Medicare, Medicaid or the Children's Health Insurance Program; TRICARE, the Veterans Health Program, a plan offered by an employer; insurance bought on your own that is at least at the bronze level; a grandfathered health plan in existence before the health reform law was enacted. If any of these apply to you, you do not fall under the individual mandate of the Affordable Care Act. And what if you do not have insurance and don't fall into any of the categories listed previously? The penalty for failure to maintain insurance will be only $95 per adult, $47.50 per child starting in 2014, and it will be a tax penalty added to the person's federal tax liability. Again, this is only if you are not exempted and are not already covered. If you have insurance, such as through your employer, and it meets the minimum coverage amount, you will not have to change it. While there are many more provisions to discuss, we'll summarize the high points already given. Under the Affordable Care Act, reducing inefficiencies in health care at $2.6 trillion in 2010 will save $780 billion per year. The U.S. GDP will save $100 billion with only a 10% improvement in national health care. Expanding health insurance coverage to the uninsured would increase net economic well-being by roughly $100 billion a year, which is roughly 2/3% of the gross domestic product. And decrease in mortality rates and the economic impact of improved medical care can benefit the GDP by as much as $245 billion. And increased funding for school health care, money to build more clinics, train more doctors and nurses, combat the top chronic illnesses that drive up our annual health care costs, stricter laws to prevent insurance companies from dropping coverage, from refusing coverage due to pre-existing conditions, and eliminating lifetime caps on coverage, and requiring insurers to spend at least 80% of premium dollars on benefits, or else refund the money to the insured. Everything that is America, our personal freedom, our dynamic industry, our military, even our schools and freedom of worship, rely upon personal health and well-being. The Affordable Care Act will improve health and well-being, lower mortality rates, improve our economy, lower the budget deficit, increase the gross domestic product, and strengthen every aspect of America. It's the right plan, it's already in effect, and it's already working for us all.